You know, just when we thought we were finally past the worst of it, gathering with friends, planning trips without constantly checking case numbers, enjoying those little things we once took for granted, here comes another headline. New COVID variant detected in 2025. And suddenly, the uncertainty creeps in again. It's like déjà vu, right? You're probably wondering, is this serious? Do I need to change anything? Are we going back to masks, social distancing, canceled plans, again? If that sounds like your inner voice right now, you're definitely not alone. It's completely normal to feel a mix of confusion, concern, maybe even frustration. After all, we've lived through a roller coaster over the past few years. So today, let's talk about it, calmly, clearly, and without fear-mongering. We're going to explore what this new variant actually is, what makes it different, and most importantly, what it means for you. So grab a cup of coffee or tea, whatever makes you feel cozy, and let's unpack this together. Let's start with the basics. What exactly is this new variant, and why is it making headlines right now? So far, scientists have identified this latest strain, unofficially referred to in some reports as XYZ.1.5, as a descendant of the Omicron family. That might sound scary at first, but here's the thing, viruses evolve. It's what they do. Think of it like nature's version of software updates, sometimes small, sometimes more significant, but always aiming to adapt and survive. The thing that's got everyone talking is how this variant seems to spread faster than some previous strains. We're seeing clusters pop up in different parts of the world almost simultaneously. But here's where it gets interesting and a little reassuring. So far, there's no solid evidence that this variant causes more severe illness than what we've seen before, especially in people who are vaccinated or have some level of immunity from prior infection. That's good news. And yes, while the headlines can sound dramatic, remember that early reporting often lacks nuance. Just because something is new doesn't mean it's worse. What matters most is how we respond, with knowledge, not panic. Now, you might be thinking, but how is this even happening again? Didn't we get this under control? Great question. Here's a little perspective that can help. COVID-19 hasn't gone away, it's become part of our reality, like the flu. The virus continues to circulate and evolve, especially in areas where vaccination rates are low or where public health measures have become more relaxed. Variants emerge when the virus has enough opportunities to replicate and change. And while most mutations are harmless or insignificant, every now and then, a version pops up that's a little more contagious or slightly better at evading our immune defenses. That's what scientists keep an eye on. But that doesn't mean we're powerless. Quite the opposite. Let's talk about vaccines, because I know that's a hot topic anytime a new variant appears. One of the most common questions right now is, will the current vaccine still protect me? The honest answer? It depends, but not in a scary way. Most experts agree that while this new variant might slightly reduce the effectiveness of previous vaccines in preventing infection, the protection against severe disease, hospitalization, and death remains very strong, especially if you've had a booster within the past year. That's incredibly important. Vaccines are like training sessions for your immune system. Even if the opponent changes tactics slightly, like this new variant, your body still remembers the core moves. That's why people who are vaccinated tend to recover faster and avoid the worst outcomes. If it's been a while since your last shot, or if you're in a higher risk group, this might be a good moment to check in with your doctor or local health provider. Some places are already developing updated booster shots tailored to this variant, and staying informed puts you in a better position to make the right choices for your health. Also, let's clear something up. Being cautious doesn't mean living in fear. It means being smart, staying prepared, and protecting the people around you. And if that means wearing a mask in crowded places again for a bit, or holding off on a large indoor event until we know more, that's not panic, it's just care. One thing I really want to highlight is how much better equipped we are now than we were in 2020. Back then, we were flying blind. Today, we have vaccines, treatments, rapid testing, and most importantly, knowledge. We've learned how the virus spreads, how to slow it down, and how to protect our most vulnerable. Let's also not forget the power of basic habits. Washing your hands regularly, staying home when you're not feeling well, ventilating indoor spaces, these simple steps still make a big difference. They're not overreactions, they're part of a smarter, more balanced way of living with the virus. Now, if you're feeling overwhelmed by all the mixed messages in the media or on social platforms, that's completely valid. The truth is, a lot of what's out there right now is speculation, and some of it just aims to stir anxiety. That's why it's so important to ground yourself in reliable information, and to take it one step at a time. We're all tired of pandemic news. I hear you. But tuning out completely doesn't help either. The sweet spot is staying calmly informed, enough to make good decisions, not so much that it drains your energy or peace of mind. And as we continue this conversation, we're going to look even deeper at where this variant is spreading, who's most affected, and what steps communities are taking around the world to keep things in balance. Now that we've unpacked what this new variant is and why it's getting so much attention, let's take a closer look at how it's actually playing out in different parts of the world. Because even though viruses don't respect borders, how communities respond makes a big difference, and there are some real lessons we can take from that. Right now, health officials are watching a few regions very closely, places where case numbers have started rising more noticeably over the past few weeks. In several European cities, for example, hospitals have reported a small uptick in admissions. Not huge numbers, nothing like the early waves, but enough to raise eyebrows. And interestingly, the people most affected aren't just the elderly or those with chronic health conditions. In some areas, younger, previously healthy adults are also reporting more intense symptoms than with earlier Omicron subvariants. That doesn't mean we should hit the panic button, but it does tell us something important. Just because you're not in a high-risk group doesn't mean you're invincible. Our immune systems are complex, and everyone's experience with the virus can be slightly different. What's also interesting is that places with high booster rates and consistent public messaging are seeing much slower spread. It's not magic, it's just consistent, thoughtful action. And that's a powerful reminder. Public health isn't just about top-down rules. It's about how each of us contributes to a larger ripple effect. Let's talk about travel for a second, because I know a lot of people are wondering, can I still take that trip I planned? Do I need to cancel or reschedule? Here's the good news, most travel plans don't need to be canceled right now. But you might want to revisit your checklist. Make sure you know the current health guidelines for your destination. Some countries have reinstated entry requirements like proof of vaccination or a recent negative test, especially for travelers coming from areas with high variant activity. Being prepared can save you from a stressful last-minute surprise. And here's a quick tip, if you're flying, bring a few high-quality masks with you. Not because you have to wear them the entire time, but because having one handy gives you options. If you're in a crowded terminal, or someone next to you on the plane is coughing nonstop, you'll feel better knowing you can protect yourself. It's about flexibility, not fear. At the same time, let's not forget the role of our day-to-day routines. Schools, workplaces, gyms, cafes, these are the spaces where most of us spend our time, and they're also where habits can quietly shape outcomes. Some schools are already taking small steps to reduce risk again, not shutting down, but improving ventilation, encouraging parents to keep kids home when they're sick, and offering voluntary testing. These aren't dramatic measures, but they help, especially in the early stages when a variant is trying to gain traction. And in offices, a growing number of companies are going back to flexible work-from-home options. Not out of panic, but out of common sense. The reality is, when people feel supported instead of forced to push through, we all stay healthier. It's easy to think that one person's habits don't matter much, but that's never been true. Think back to the early days of the pandemic, when just one person staying home could stop a chain of transmission from starting. That same principle still applies. Maybe even more now, when we have the tools and experience to act early, rather than react late. Now, let's talk about the emotional side of this, because honestly, that's just as important as the science. Hearing about a new variant can stir up anxiety, frustration, even anger. Some people feel exhausted by the idea of dealing with COVID again. Others feel numb, like they've tuned it all out. And then there are those who feel hypervigilant, constantly scanning the news, trying to stay one step ahead. All of those feelings are real. They're human. But here's what I've learned, and maybe you've noticed this too: resilience isn't about pretending things are fine. It's about facing reality with clarity, then choosing how to move forward without being paralyzed by fear. It's about knowing what's in your control and letting go of what isn't. We can't stop new variants from emerging, but we can choose how we respond. We can take care of our bodies, get rest, eat well, move regularly. We can keep our minds steady, limit doom scrolling, talk things out with people we trust, take breaks from the noise. And we can check in with our communities, ask how others are doing, support vulnerable friends or neighbors, and share useful information without spreading fear. That's how we stay grounded, even when the headlines feel like they're spinning. If you're someone who's been unsure about getting a booster or still on the fence about wearing masks again, I get it. Nobody likes being told what to do. But think of it this way: your health decisions aren't just about you. They're about the people you love, the people you live and work with, and even strangers you'll never meet. That's not pressure, it's empowerment. You have the chance to be a force of stability in an unpredictable moment. That's something powerful. And if you're a parent trying to decide what to tell your kids, here's a simple idea: just be honest in an age-appropriate way. Let them know that sometimes viruses change, and that scientists are working hard to understand what's new. Remind them that they're safe, that adults are looking out for them, and that taking small steps, like washing hands and covering coughs, makes a big difference. Kids are smart. They don't need perfect answers. They need reassurance, and they take their cues from how we respond. And for anyone feeling burnout or hopelessness creeping in, remember, we've done this before, and we've gotten through worse. Yes, the world keeps shifting. But every day, millions of people are still showing up for each other, with kindness, with patience, with courage. That hasn't changed. When we start thinking about how to move forward from here, it really comes down to one question: what can we actually do about all this? Because let's be honest, when a new COVID variant makes headlines, it's easy to feel like everything is out of our hands. But the truth is, we've learned so much since those first uncertain months in 2020. We've got more tools, more research, and more collective experience than ever before. And that makes a difference. Let's start with vaccines. A lot of people are wondering, are the current shots still effective? Should I wait for a newer version? Is it even worth it? Here's what the science is showing so far. While the 2025 variant does have some mutations that allow it to partially dodge immunity, updated booster shots are already being developed and distributed in many countries. And even the previous boosters still offer significant protection, especially against severe illness, hospitalization, and long-term complications. So no, it's not all or nothing. Vaccines aren't perfect shields, but they're powerful tools. They give your immune system a head start, so if you do get infected, you're more likely to recover quickly and stay out of the hospital. And this next part is important. Getting vaccinated isn't just about protecting yourself. It helps reduce the spread in your community. The fewer people who get seriously ill, the less pressure there is on hospitals. That means other patients, whether they're giving birth, having surgery, or dealing with chronic illness, can still get the care they need. That's public health in action. But vaccines aren't the only thing in your toolkit. Staying healthy right now is about taking a layered approach. You don't have to be perfect, you just have to be consistent. Maybe that means wearing a mask on the subway again, or opening a window during indoor gatherings. Maybe it means taking a rapid test before visiting your grandparents, or being okay with saying, "Hey, let's reschedule, I'm feeling off today." These are small things, but they send a message: I care. I'm thinking of others. I want to do my part. And speaking of doing your part, this is a moment when good information matters more than ever. Because as we all know, misinformation doesn't just live on shady websites anymore. It spreads through group chats, social media, even casual conversations. If someone in your life is confused or unsure about the variant, share what you know in a way that's kind, not condescending. Nobody likes being shamed or talked down to, but almost everyone appreciates honesty and a little empathy. You don't have to have all the answers, just a willingness to talk and listen. And if you're not sure what's true yourself, that's okay. Go to the sources you trust. Look for updates from health departments, local hospitals, or international experts who explain things clearly. Follow people who are thoughtful, not just loud. This is also a great time to check in on your own well-being, not just physically, but mentally and emotionally. Because let's face it, the stress adds up. You might be feeling anxious about what's ahead. Or maybe you're frustrated by people who aren't taking precautions. Maybe you're tired of the whole conversation altogether and just want to live your life without thinking about COVID anymore. And you know what? That's okay. It doesn't make you selfish or lazy. It makes you human. What matters is how we navigate those feelings. That might look like taking a break from the news for a day, or scheduling something joyful to look forward to, or talking to a therapist, journaling, meditating, whatever helps you reconnect with yourself and stay grounded. We've all been through so much. And while it's true that the pandemic has changed the world, it hasn't taken away our ability to adapt, to care, to show up with hope and compassion. Because here's the thing, even in uncertainty, we still have power. The power to learn. The power to support each other. The power to make choices that keep us safe without living in fear. This new variant may bring a few twists, but it doesn't erase the progress we've made. Scientists are better prepared. Health systems are better equipped. And most importantly, people like you are more aware, more thoughtful, and more capable than ever before. So whether you're stocking up on home tests, getting your booster, having a family conversation, or simply taking a moment to breathe, you're doing your part. And that matters. If this video helped you feel even a little more informed or more grounded, I'd love for you to share your thoughts in the comments. Let me know, how are you navigating this moment? What's helping you stay calm and focused? Your story might just help someone else feel less alone. And if you found this helpful, go ahead and give the video a thumbs up and subscribe to the channel. We're all figuring this out together, and there's a lot more content coming to help you stay safe, healthy, and empowered, no matter what comes next. Most of all, remember, it's not about having perfect answers. It's about staying curious, staying compassionate, and staying connected. We've got this. One step, one breath, one act of kindness at a time. Take care of yourself, and I'll see you in the next video.